All right. Well, thank you all for joining today. So, we are here to give you some information on our 2026 Title III Older Americans Act funding and answer any questions that you may have. All right. So kind of for a rough agenda today, I'm just going to give you a little overview of the history of the Older Americans Act, um, our funding, what the different titles are, and then our reporting and our application process. So I see a lot of familiar faces and some new ones. So a handful of you might already know all this, but it's always good to have a refresher. All right, so for 2026, this will be a competitive round. So anybody is able to apply for funding for 2026. All right, so a little history on the Older Americans Act. So Congress passed Older Americans Act in 1965 in response to concerns by policymakers about the lack of community social services for older adults. So the act authorized grants to state for community planning and social services, for research, and then training in the aging field. And when this was created, the law also established the Administration on Aging, and then that was housed in under ACL, so the Administration for Community Living. And as of May 2025, the Older Americans Act has been moved to the newly established Administration for Child, Family, and Community under HHS, and that the acronym is ACFC. So it's kind of a mouthful. Let me see. Okay, I just want to make sure no one else was in the waiting room. All right, and then for the aging network, so it kind of starts at the federal level, and then funding gets funneled down into the states. And then from the states, so like for Minnesota, it's MBA, so the Minnesota Board on Aging. And then that is passed down to the area agencies on aging. And right now in the United States, there are 622 area agencies on aging. I believe there are 6 in the state of Minnesota. And then, so that is, we are one of the area agencies on aging. And then it is passed down into the local level for the local service providers. So you guys. And with the act, there are a handful of different titles. But the one that we have is Title III, so the grants from community programs on aging. Another one you might be familiar with is Title VI, and that is grants for the tribes, or Title VII, which is from the ombudsman, I believe. All right, and so for 2026, and I guess for the Title III, we have these 4 different buckets. And that is for Title IIIB, which is supportive services. And we have a laundry list of different services that can be provided, but the ones on the screen are just the ones that are most commonly used in our area. Let's mute. Can everyone make sure that they are muted, please? I was just getting some feedback. So for Title IIIB supportive services, we have legal education, legal assistance, homemaker, chore, assisted transportation, just regular transportation, consultation, consumable supplies, technology. Like I mentioned, there is a list, and if anyone, it is on the application in Smart Simple, so you can see that list of all of the services that you can provide with the funding. Just these ones are our most popular. And then we have Title IIIC, which is our nutrition services, our home delivered meals.
Gina, can I just interject? It says
Yes.
The estimated funds is 394. How does that compare to 2025?
I believe it's pretty similar. I don't have those numbers up
Oh,
right
okay,
now. I can pull them up during Q&A though, and I can let you
okay,
know.
okay, thank you.
All right, and then for nutrition services, home delivered meals, congregate dining, and yes, on the bottom right, the estimated allocation. So we just received that allocation last week from the state. It may change because this is an estimated amount, but usually it's pretty accurate when they give it to us. And then Title 3D, which is our disease prevention, health promotion, our evidence-based classes. So falls prevention, chronic disease self-management, those good classes. And then our Title 3E caregiver support, so our respite, caregiver counseling support groups, um, supplemental services, etc. And that estimated value is also listed. All right. So for Title 3, so we have our eligible clients and then our targeted populations. So our targeted populations are they're different between caregiver services than our supportive services, nutrition, and our evidence-based programs. So our supportive services, nutrition, and then evidence-based programs. So anyone that is 60 plus can receive services, like they're eligible to receive services under this funding. But our targeted population is anyone 60 plus with the greatest economic need and social need, with an emphasis on low income minority individuals, just low income individuals, older adults residing in rural areas, which is most of our service area, and then if individuals who struggle with ADLs and IADLs. And then for our caregiver services, it's a little bit different. So the eligibility is a family caregiver of a person who is 60 plus, and our targeted population is a caregiver of an elder with multiple chronic conditions, age 60 plus and greatest need, with an emphasis on low income minority populations, and a caregiver of persons with Alzheimer's disease or related dementia, regardless of age. So we have been seeing an uptick in younger folks being diagnosed with dementia or Alzheimer's disease, and those people can be served. Sorry, it's like getting real dark here, and I feel like I had the lights off when I started this meeting. That was real dark. um, and so for this funding cycle, so we are on a 3-year funding cycle. So 2026, this will be new projects. It is a competitive round, so anyone can apply. And then the following 2 years, so 2027 and 2028, will be renewals. So only the people who are accepted for 2026 will be able to apply for the consecutive 2 years afterwards. So for funding for 2026, service priorities will be established by our ACA members. And then there will be a review task force that scores applications, and we have folks from all 7 counties that review. So we try and keep it unbiased. And then those will be selected in the fall of 2025. So that the review task force, I believe, meets in October and November. And then it is pretty much the same for the next following years. So for 2027 funding, a review task force meets in the fall of 2026. All right, and so for the application process, it is all on our Smart Simple, where you'll upload a budget. There are narrative questions, and then there is a tab for attachments, which we ask for organizational information, a person serve report, and then some outcomes. And then we ask for assurances, And so those are assurances of compliance with federal regulations, the Minnesota Data Privacy Act, etc. And while you are filling out the application, if you have any questions, you can always reach out to me for those. And then, so reporting requirements for this funding. So monthly, we have for registered services, we have a NAPIS client registration forms and the client rosters, and those are sent to the Quad A staff by the 3rd of the month for the services for the previous month. And so there are registered services and unregistered services, and so registered services require a NAPIS registration form. I can show you a blank one after this. And then, but we don't require it for unregistered services. And if you have any questions on that, we can chat about that after. It is a little confusing. And then our quarterly reporting, we ask for a financial report, narrative, and then a person served report for those unregistered services. And then we do have a biannual report that goes in with the quarterly reporting. Progress report for like a person served on low income and minority individuals, and then an outcome-based evaluation form. And then we have an annual report. So this annual cost share report goes in with the last quarter report, and then a final financial, which is usually in the February of the following year. Right. So let's see if I can throw this over to show you what a registration form looks like. Are you able to see that, or is it still the slide? All right, so this is what a registration form looks like. So we ask for a person's basic information, and then their social history, their financial status, their emergency contact, and then we have some questions for ADLs and then IADLs. And we can't turn anyone away for not filling out the form or not filling it out completely. The basic information that we need is their name and date of birth, so we can put them in the system. And this is only for registered services. So if you have unregistered services or plan on asking for funding for unregistered services, this would not be needed. And to know if they're unregistered or registered, you can either ask, or on the list of services that you can use the funding for, it'll let you know if it's unregistered or registered service. Yeah, and then just questions and answer for the last bit of time. I wanted to leave more time for questions just so everyone can go into this feeling like they have a good foundation. I see, Janet, you have your hand up.
Yes, thank you, Gina. My question, I'm from Duluth. We are working with Health Equity Northland. Currently have a Board of Aging grant. We're interested in this grant because we've had one, I think, a few years back with your organization. So thank you. My question is, how are we reimbursed? Is it monthly or is it a quarterly?
It is quarterly. So when you fill out your quarterly reporting and the financials get processed and sent to the state, and then the state then reimburses the AAAs, and then we send out the reimbursement to you quarterly. All right. All right. Amy Wyant, I see your hand is up.
Yes. Good morning, Gina. For the 3E I'm wondering what comprises supplemental services?
Yes. So there are a variety of different things. So right now, one of our providers is using supplemental services for technology, and they use those funds for, I think it's through Pell Medical for um, like the alert system. But you can use it for transportation. Um, so kind of a, I don't want to say a loophole, but if someone is needing transportation services and they're under 60, but they like we just had a situation come up where somebody was under 60, but they were diagnosed with dementia. And so they couldn't be served under 3B because of they were under 60. But they needed like transportation, and that was able to serve them under the supplemental services.
Thank you.
Yeah. Marilyn, I see your hand is up.
I think I'm gonna pass right now. You know what, I'm wondering, because we do the 3C 1 and 2, if you want to wait for questions on that, unless there's other folks that might be interested in applying, because I have a number of questions there. And one of the questions that came up is the reimbursement, so I'm just assuming that doesn't necessarily pertain to C1 and C2.
Yes. Yep. Sorry about that. Yes, C1 and C2 is monthly
Okay,
reimbursement.
so that might be better, is unless, we wait on our questions.
Yeah, that's fine.
Okay, thank you.
All right, Janet, I see your hand is up.
Yes, I have another question regarding application and narrative.
Yes.
Is it best, or should we stay neutral on looking at specific communities, especially with the political narratives now? If we're wanting to work specifically for African American, African heritage community, uh, is that something that might be flagged to be good or bad?
I would say it would be good because our targeted population is minority individuals in the area. So I would not hesitate to have that on an application. No.
Thank you.
All right. Any other questions? I don't see anyone else's. Let me check the chat. Not seeing anything on there. Well, if there isn't any other questions right now, I can give you guys back your another half hour. But if anything comes up, please don't hesitate to reach out if you have any questions that come up once you're starting the application or something you think of in the middle of the night, like, oh, I should have asked that. Don't hesitate to reach out. I will put my email in the chat.
Gina,
Yes.
I'm not sure if I missed it, but were you going to share the difference on is there been an increase or a decrease or a change at all in the overall funds?
Yes. Let me see if I can find that. All right. Bear with me for a second.
And while you're looking, I'd just like to give a big whoop whoop for that we're having a normal conversation today and not any kind of like due to something, there's limited funding. So
Right.
I'm glad that this is just a standard meeting about the opportunities. So that's good news on the federal front.
Yes, thank you for bringing that up. It's been a little rocky, to say the least. And I see there are some other AAA staff on here. If anyone has anything that you think I missed or would like to jump in, feel free while I'm looking this
Gina,
up.
I do have another question. This is Janet
Yes.
Kennedy. So looking at the funding sources, and you had stated it sounds like it's about the same as before. What is the likelihood, or are you able to expend all of the grant funding? I remember the last year we received a grant around COVID is because you had some like leftover funds or funds that weren't spent. Is that the same case, or is it competitive? When you say competitive, I know it's not necessarily against one against the other, but competitive in the way that anybody can apply, where it's not limited. But are you finding that you're able to support the organizations that actually apply?
Right, yes. So every year, if funds aren't spent through like the AAAs aren't able to spend funds, it gets allocated back to the state, and then they put it all in one bucket and then reallocate it out. I believe that is I believe all of those were already put in for 2025. But yes, sometimes we do have like a random allocation of funds, and we usually like to pull in like smaller projects or someone who's just like a newer organization that kind of just wants to try using title funds because it sometimes is a little tricky. So yeah, right now this is what we have for the year. I have not heard of any new allocations. Hopefully that answered your question.
Well, I guess not necessarily, because the answer would be once we fill out the application, if we're funded or not. But have you seen that you've had to turn organizations away, or do you have enough funding to support everyone that applies? Would be the real question. I'll yield.
Yeah. I mean, in the past, there has been some decreases just because of less funding coming to the state. And, but I am not sure for this year because I'm not sure who's applying and for how much. So I guess we'll just have to wait and see. But I am assuming we'll probably have to cut just because of trends in the past where we have had more requests than money that we have had.
Yeah, and thank you. Yeah, that makes sense that you don't know how many folks are going to apply. So I understand that piece. Thank you.
Yes. All right, I'm going to share my screen so you can kind of see these numbers again for the year.
And Gina, while you do that, this is Lori.
Yeah.
Marilyn, did you or anybody else who's applying for Title III, C1 and 2, did you have questions, or would you like to send them, and then we can do a Q&A specifically for 3C, and then be able to publish those answers? Do you want to do that, or do you want to ask those questions now?
Well, I was thinking we would, for people who aren't applying for C1 and 2, they could just leave the meeting and we could continue. We still have a half hour. I mean, we still might have more questions afterwards, but that's what my thought was.
Okay, I'm down for that. Okay, thanks.
Could you let us know what C1 and C2 is? I'm not sure if I'm even in that category.
Yeah, so
That
did you want to jump in, Lori?
Senior, sorry, that is the senior nutrition program.
Thank you.
Oh shoot, did I not share my screen yet? I'm sorry. I thought I did. So there is this. So a little bit more for 3B and 3D and a little less for 3E caregiver support. And maybe about the same for nutrition.
I have another question for the home delivered meals. You have to be like a Meals on Wheels type of organization? Because we do nutrition isolation work with our elders during our season where we have a community giving garden and we do deliveries to them. Would that be eligible or no?
I believe you have to serve all 7 counties for nutrition. So no, but that could technically go under 3B under consumable supplies. We've had something similar in the past with that. So
Oh, I wouldn't
um,
even gotten that because consumable supplies doesn't mean food to me, but I guess it does.
yes, yeah. So consumable supplies is food or yeah, like supplies that like toilet paper, paper towels, toothpaste, all that good stuff.
Okay, thank you.
Yep. And Beth, I see your hand up.
So for the Title 3E caregiver support, could we apply for that if we were wanting to start that in our organization? Would that be like something we do as a startup in addition?
Yeah, you could definitely do that.
Okay.
Yeah.
I have a follow-up if
Yeah, Janet, and then I'll come to you, Cheryl.
sorry about that, Cheryl. I didn't mean to cut you off. I'm on my phone, so I'm toggling between trying to see. So under the 3B, we're completing a respite care program, sort of visiting elders, especially folks with dementia or other Alzheimer's related diseases, like in facilities and congregate living. And this year we have some young adults that are 18, 19 that are interested in doing that work. And we were going to maybe do some training with them so they can be trained on understanding, what they're doing when they're going to visit. Is that something that would be a sort of program like that would be eligible?
So I think that would fall, that sounds like just under the brief information, that would be like under a visiting program in 3B. Where you kind of just go and visit with someone, not necessarily respite, since they're in a setting, in like a
Okay.
community living setting.
And then could you explain to me what the respite would be?
Yes, so caregiver respite would be somebody going into the home for in-home respite, or there is like adult day respite. So like in-home respite would be like a caregiver, someone coming into the home to relieve like a caregiver so they can um, like go run errands or get stuff done in the house while somebody is with their the care receiver. Or if there is like an adult day setting, that would be um like a caregiver bringing someone to a facility for like a group, and then they can leave and go do errands or whatever they need to have done, doctor's appointments, stuff like that.
And is there one area you said that was for training? And then I'll yield. For maybe
um
training individuals to.
oh, that was like just under the history, so the act funding it was used for training folks for aging individual, like on the aging folks.
Okay. Thank you.
Yeah. And then Cheryl.
Hi, thanks. No problem. I don't mind. So on the Title 3E, I have to move this to a bigger screen. Um, for that supplemental services, could that include, um, oh, what is it called? Um, senior companion services?
Potentially, I'd have to look into that, but that also like reminds me of like the visiting. Um, like during COVID, the visiting was used for like volunteers would make phone calls to folks just to chat and see if they needed anything, make sure that they're doing okay just when they couldn't meet in person. Um, but I can look into that, Cheryl,
Okay,
and let you know.
yeah, we're looking at kind of funding for the senior companion program that's going on right now.
Okay.
So, and then the other one, the support group, is that like only certain types of support groups? Or could that be, like, we're looking at starting up an ambiguous loss support group?
So it's mainly just for like caregiver support. So people who are currently caregiving for a
Okay.
loved one.
Okay, I didn't know
But
if that was
yeah.
just mainly for the caregiver or, or if it opened it up a little bit. Okay, thank
Yeah.
you.
All right. Are there any other questions that were sparked? If not, I can let y'all go, except for anybody who wants to discuss senior nutrition. You can stay on for the last 25 minutes or else. Thank you all for joining, and yeah, feel free to reach out if you have any questions.
Thank you.
Thanks, guys.
All right, is this everyone who wants to stay on for senior nutrition? All right. Oh, I'm still sharing. I'm sorry. So am I right that senior nutrition has to cover all 7 counties if you under C1, C2, Rebecca? Nutrition is its own beast, and there's a lot.
So
I
what
think as
happened
a-
with that? What happened with that, Rebecca? Because that's not what the RFP states now.
that we have to cover all 7 counties? I think,
No,
no, I think us as a AAA, like we have to have service in every county, but it can be through like multiple providers.
yeah, but that changed now. I
The
don't believe it was that way
one
before.
unit, you have to cover a whole unit, and a unit is a county. So you have to,
Oh, you have to cover at least one county.
you don't have to cover all. Right. Like Rebecca said, as a AAA, we need to cover all 7 counties, but an entity receiving and serving senior nutrition, the unit is 1 county.
Okay. And another question is the being open 5 days a week. If a site is open, if a site is open 3 days and there's a site, 5 to 10 miles away that they could access for the other days, would that be permitted?
So
No.
we're still, yeah, I don't think they're gonna budge on
Who
it.
said no that quickly? Lori, was
Lori
that
did.
you? Lori,
That was me, Marilyn. I have been fighting this. It used to say in the Older Americans Act that states had the discrepancy to change that ruling for rural areas, but MBA and DHS, MBA has made the final rule that no, it has to be open 5 days a week. It
but
can't
it's
be a
not necessarily
combination.
at the federal level. It's not necessarily at
Right.
the,
No, that's happening at MBA's level.
so
I
that's
think,
something I should have a fit about here.
yeah, yes. I don't think they realize how many sites will close if that happens.
Well, Virginia grandmas,
Mhm.
Duluth grandmas, Harrison in Duluth will close. What other city? Portman will close. Evergreen will close. That's kind of changing anyway. So it is a shame, especially when there could be sites that are, close that people could, take their other meals at. Finland,
Mhm.
where those are really rural, remote, and we talk about social isolation. It's just, well, sad commentary.
No, yeah, it's I think our region and the Dancing Sky will have the most rural sites that don't fit that 5 days a week. But then in the metro area, there's also some, like a few culturally specific congregate sites that don't meet that minimum that they'll also lose. So I feel like there's still, like you said, we should be throwing a fit about it. And there's
Yes.
some, I think there can be some give there if they
Okay.
realize the impact.
So, I'm kind of, so we probably shouldn't include them in our proposal then, any of those sites.
Um, you can, I mean, so the final rule, it depends on how quickly, how do I word this? So we don't have to come into compliance until we have longer than October. So if
Okay.
it's hard to close a site and then reopen it.
Yes.
So I would say, I mean, if there's some that are looking like they're gonna close anyway, sure, you can leave those out, but I wouldn't want to close them all and then we find out actually there's some leeway there.
Yeah. So, this will be the first year that congregate will be put into that portal. And so we have to cut and paste for congregate and then cut and paste the exact same thing for home delivered meals.
Mm. Are
Yeah.
you talking about in Smart Simple?
Yeah.
And then appendixes too.
I'll
And
let
all the
Lori and
appendix-
Gina answer.
Laura, you better have this answer correct because you'll be on my list.
What do you mean by cut and paste? I'm still learning, Marilyn.
Because you know what it does it make sense to you that we have to cut and paste the exact same thing? I'm not changing my answer for each of the questions, which they've been included all together, and the budget page includes all three funds, for C1, C2, and waiver, and your budget, the proposed budget includes all those three. So I'm just wondering.
Oh, I see.
Lot,
So we have on Smart Simple C1 and C2 open as
Yeah.
accepting application. Okay, yeah.
Can
I
you
think,
guys combine it and put C1 and C2?
yeah, I mean, I would just say submit it all under one of them and let us know which one.
Okay, and so you're
Yeah.
taping this. I have you on tape, right?
Yeah. Yeah.
I'll see if I can change it to be
Yeah.
to say both.
Okay. Oh, well, that will help a lot. That's a
Mhm.
lot of cutting and pasting. So
Yeah.
please,
Yeah.
that would be wonderful.
Thanks for saving my neck, Rebecca.
I
Because
mean, hopefully we can do that. I don't know. I just think we should
Lori,
be able
I
to.
get even. And we'll have to, so when do we have until the last to ask questions? Do you have a deadline where we can't ask you questions anymore?
Yes, let me look that up real quick. I can't remember the
I
date
thought it
off the
was
top of my head.
was it August like 17th or something? You don't want to take any more questions or?
That sounds right. Sir. The
We have someone
application is,
waiting in the lobby. Emily
yeah.
Racklin?
She just came in, she's late. I was gonna message her. She's
Okay.
not nutrition.
Okay. Okay. I don't know, do we have any other questions really?
Ones I found that fine. Oh, do we know a bit about this thing? What? Do we still stay on the car? I think I'm down to we say that is a sin.
So Betty had this whole subcontracting, you know, we're kind of going around. When in the language, subcontract means that we give some funds, Title III funds to someone else and they allocate that. So
Mhm.
are our caterer contracts, are they considered subcontracts? Do we say on that part 6, subcontracting, that we plan to subcontract?
For a caterer, no, I think that'd be considered a vendor.
Okay, perfect. But we'll do what we normally do with with their agreement, service agreement. You'll get a copy of that.
Yes, yep.
Yes. Okay, perfect.
The date is August 15th.
Oh, okay. And no more questions after that.
Yes.
Okay. Betty's pushing me not to be last minute Maryland this, year that we're, getting it in on the 29th.
I see you have a draft started, so that's good.
Till July 29th is what I'm thinking.
So you know what, I also wanted to introduce Carrie Pellinan. She's sitting in. I'm trying to show her the ropes a little bit on our RFP and that, and because I'm not going to be here forever, guys. And Lori is just, yeah, good thing we don't see Lori's face because she's just smiling from ear to ear.
Oh. Mm-mm.
Are you announcing something, Marilyn, or are you
And
just saying in
Lori's not
general?
even denying that. That's what hurts my feelings, Lori. You're not even denying it.
Awfully quiet.
Otherwise, our main question was the 5 days a week, the cut and paste for 2. And, we will be putting, our proposal in for all 7 counties. And, okay, the other question would be, also, it's not just the cater contracts. We have nonprofits that we contract with to provide, recruiting our volunteers.
Coordination,
Yes, for coordination. That would also be considered a vendor because they're not giving out Title III funds. Correct?
yeah. Are they like determining, are they doing like the NAPIS registrations or, okay,
No.
then no, they would just be
Okay.
a vendor.
Yeah, okay, thank you. And I don't know if we have anything else at this point.
All right.
Wait, Betty just showed me one more thing. You wanna bring it up?
Oh, well, I just was reading something about, when we send out our contribution statements, it says something about you can't put like past due balances on them. Because we have a lot of people that just pay like every 3 months or every 6 months. They have family members that don't want to send a check monthly. They want to just wait and pay in a big lump. So is that something different or do we have to worry about that?
I think if you're not calling it like a past due balance, I think they're just trying to make sure it doesn't look like a bill.
Okay, so it, as long as it says a contribution statement and no one is turned away. that's
Right,
on there?
yeah.
Okay, we should be all right.
Right, and you could, Betty, you could write it as like, May, June, July, and could do it that way, but not using the term past due.
Okay,
Okay.
okay, that makes sense. Okay, I think we're good
For now, yeah.
for now. And if we have questions, just direct them to Gina then? Or Lori, or
Yeah.
both?
Well, why don't you do both? Gina's officially the lead, so, falls on her
So-
shoulders.
So she gets the blame then. Nice, Lori. Okay.
We do that, Marilyn.
Okay, Lori, you thought I was going to change for some reason. Okay, I think we're good.
You keep me on my toes, Marilyn, and I'm learning a lot, so I appreciate you.
Okay, did you hear that, Carrie?
I'm taking notes.
Oh, okay. Okay, well, thank you.
Thank you, everyone, for letting me be a fly on the wall today.
Oh,
For sure.
No worries.
Okay,
All right,
bye.
thank you.
bye. Take care.
Yeah.